All right, very happy to have with us here Dr. Richard Jones. He is a cardiac electrophysiologist at MedStar Health. Doctor, we're talking about atrial fibrillation today, the most common type of irregular heartbeat. Can you talk a little bit about this very common condition that affects millions of people in the United States?
Absolutely. You're exactly right. It is the most common heart rhythm issue in the US and indeed in the world. And it's characterized by an irregular heart rhythm. And in atrial fibrillation, the top chambers of the heart fibrillate or quiver. They're moving so fast as to not be moving blood well. And when that happens, when blood doesn't move well, it can form blood clots. And this is what leads to one of the most feared outcomes of atrial fibrillation, if you will, which is its increased risk for stroke. And so it's an important topic for today, and indeed an important topic that we deal with every day.
So I guess drilling down on that a little bit, I guess you gave us some of it, but what exactly is AFib as it's called? So it's the fluctuation and then the clotting that forms. And that's what makes it so dangerous, right? Because clots can go pretty much anywhere at that point.
Correct. And a clot that goes to the brain is a stroke. But it's this irregular rhythm where the top chambers quiver. And what it can cause is a whole variety of symptoms. It can cause people to feel palpitations, to feel like their heart is racing. It can cause people to feel fatigue. It can cause people to feel short of breath when they move around. It can have all of these different kind of symptoms that folks can present with. The cause of it, at least in the form of AFib that kind of comes and goes, which is a little different than the form of AFib where someone goes into atrial fibrillation and gets stuck in the rhythm, the most common cause is what we call abnormal electrical firing in the heart or pulmonary vein firing. These little electrical areas within the pulmonary veins, the veins that bring blood back to the top chamber on the left side of the heart, can have little firings that take the heart into atrial fibrillation. And so when those firings happen, then the heart can go into AFib. And in some folks, they go in and out of it, what we call paroxysmal atrial fibrillation. And some folks, they stay in atrial fibrillation, what we call persistent atrial fibrillation. And then there's kind of a third big category that we call permanent atrial fibrillation, where the patient and the doctor have decided to kind of leave them in AFib for one reason or another.
It's a terrific description for those who are experiencing symptoms. What are they? How do you know that you have AFib?
Yeah, it can be somewhat very nondescript, like I was mentioning before. People feel their heart fluttering, if you will, or their heart racing fast. Most people tend to go fast in AFib, so they tend to feel that fast fluttering. Some people go slow and can really feel that irregularity. Other people can feel an intense kind of fatigue with AFib, or once they break out of AFib, they can feel very fatigued. When they get walking around, in particular, folks report shortness of breath. Or if you exercise a lot, if you think of someone who's younger with atrial fibrillation exercising, they may experience an exercise intolerance. They're not able to do what they once could. Or in someone who could walk up their driveway that has a bit of a grade, maybe they find that they're much more short of breath than they were before. And so these are some of the common symptoms of AFib.
Lifestyle changes. If you have something that resembles AFib and you find out about it, what are some of the lifestyle changes that perhaps you can make to alleviate some of those things?
Yeah, I think part of the beauty, if you will, to some extent of atrial fibrillation is that it ties into everything. It really ties into overall health, overall cardiac health in general. The things that are good that we typically think of as being good for the heart are good for preventing atrial fibrillation as well. We often think about heart attacks and ways of preventing heart attacks and strokes that don't come from atrial fibrillation. Well, all the same applies to AFib. So maintaining a good, healthy body weight, preventing things like high blood pressure and diabetes, treating sleep apnea when it's present. These are all very important in the overall treatment of atrial fibrillation, and these kind of what we call modifiable risk factors have really become a hot topic within the treatment of atrial fibrillation.
Finally, doctor, if someone suspects they may have AFib, besides potentially contacting a doctor, what should they do? What are some things that they can do to try and alleviate that?
Yeah, and we're seeing more and more of that today, aren't we? Because with wearable devices like the Apple Watch and you see these cardiomobile devices that are advertised, people are becoming more engaged and wearing devices or using devices that allow them to track their own heart rhythm and their own heart rate. And so when they see, something that's weird or something that stands out, or the device says it's an irregular heart rhythm, or even, some devices will say this looks like atrial fibrillation, by all means, bring that to the attention of your primary care doctor or your cardiologist if you have one. And I think doing that will allow them to help put that in proper context.
Well, doctor, it's Heart Health Month, and we appreciate you stopping by and filling us in. Dr. Richard Jones, thank you very much.
Thank you.